So let's get started. Um, Wislyn, thanks again for being here. Thanks to everyone tuning in during this portion of our Giving Week, Together for Good. Today we're talking about health. We're here with Dr. Wislyn. He's our medical director in Haiti. He's the medical director at CHIDA Hospital. Wislyn, how are you doing?
Hey Jack, hey Roger. I'm good. What about you?
We're doing well. I'm really excited to have this conversation with you. Our viewers, our listeners are as well. You did such a great job at our event last year. Again, just wanted to say thank you for coming to the States, being a part of that. And obviously, you're a big part of things this year. But I would love for it, Winston, if you could just introduce yourself. I'm going to use some visual aids kind of throughout our presentation. This is a great picture of Wislyn and his wife, Sushana. They have a growing family. If you could just introduce yourself, Wislyn, and potentially talk about your family, that would be great.
Yeah, so it's a pleasure to have you and hear from you. And let me introduce myself and give you a short story about the one I am. So as you know, I am Wislyn Havernaud, and I'm a married man, and my wife name's Sushana Yoramia, and I have two daughters. The first one named Wesleika Avenard, and my newborn about a week ago named Wiskeisha. The name are close, they are close, but not the same. Yeah. And I am the medical director of CHIDA's hospital, a part of IDD organization. So it's a pleasure to have you and have contact with you today.
Yeah, it's great. That picture's, I don't know how many days you send that to us, but brand new baby. We're super excited to welcome her into the world. I can't wait to meet her. So Wislyn, you are a product of, you grew up at Ebok Orphanage. Some of our listeners will know of Ebok, will know of, some of your story, but I would love it if you could just share with us kind of your journey from Ebok to, like we said, now you're the medical director of a hospital and the community in which you grew up in. So I'd love to hear how you kind of got from this image here to this image here. I have a couple of images following of just kind of the process of CHIDA being built. But again, if you could just share with us part of your story, how you came from, growing up at Ebok to, now the medical director.
Yeah. So I've got a back on 1994, and the reason was because my parents would not support me with 11 kids and very hard life. They could not support me at all. So as my father knew Pastor CBN, they decide to take three of us to Ebak Orphanage. So when I got there, it seems like, hmm, maybe some opportunity were able to, were there for us to, to go forward. So I got to Ebak when I was 10 years old, and that was my first time to go to school because, as you know, they could not support me. They could not either send me to school. So when I got to ABAC, 10 years old, that's when I was in school for the first time. So when I got to ABAC, my biggest my biggest meaning was the way that they teach us about God. But everything that I am now, everything that I will be, it's because of the meaning with God, the way that they teach me how to love God and how to serve Him. And then I went to school and I spent about 20 years at the ABAC orphanage. It wasn't perfect, but I could say that that was exactly what I need to success. And the two ladies, Alice and Kathy, Pastor Sabian, there was about 90 kids at ABAC at that time when I got to ABAC. And that's where I grew up for 20 years and serving. They were able to send me to school, to feed me, give me a place to stay, give me a bed, and to wear me, because it was like two different things for me when I got to ABAC. Because when I was at my home with my parents, you may have one clothes for the whole year, one shoe for the whole year. And
Mm-hmm.
sometimes it was difficult for you to eat, and we could not even go to school. And we wanted to go to church, but because we did not have clothes, we could not go to church. And that's why when I get to ABAC, I could see that it was a very, very big opportunity for me. So the only thing that I had to do is to go to church, love God, and go to school, learn what I have to learn, and to become someone today. And so that's what I did, and God was with me as well. So I spend my time, I go to school, and He had me to success in school. And then after high school, it was difficult for me back to go to university, because the the support was not as big to support everyone that finished with high school to go to university.
Mm-hmm.
But that when I met a woman that decided to support me, and PKF by Pastor Brad, and was there to push me and had me go to Port-au-Prince. That's the only place that people can go for university at that time. And then I got to Port-au-Prince in 2007 and started med school. And as you know, in 2010, when I was in my third year of med school, there was the big earthquake in Port-au-Prince, and there was a lot of damage. So at that time, I was in school from 8 to 2 o'clock. And then I decided to leave the school because I was hungry at 2. And I went back home, and I had to go back to the school at 4, from 4 to 6. And I fell and slept when I got home. So I hadn't time to go back to school. And then, unfortunately, when the earthquake happened, everyone from the school that was in the school at that time died from the earthquake, and 30 of my schoolmates died from this tragedy as well. So God saved me because He had a plan for me and wanted me to serve others. So after the earthquake, I went back to Puerto Rico after 4 months and keep going with school and become a doctor in 2015. I graduated from school and get married a week after that. And now, as we used to do mobile clinic in the community of Balen, close to IDD, and we could see the
Mm-hmm.
need of these people, malnutrition, you know, any kind of pathology, illness that people were not able to go to hospital. It's not because they could not find someplace, even they are not very close, but the problem is that they they are not able to go. They are not able to afford the bills, or even they know to go, but because of education, they did not feel that they need to go, because voodoo was a big thing for them. Anything like if they are sick, any problem that they have, they attribute it to voodoo. So we said that this is a place that we need to do something and to change the mentality and have a team of people that are willing to help and their help. And with Pastor Brad from PKF and the IDD board and we sit together and we work for about 3 years to have this project happen. And this is now we have CHIDA, so I am the director now.
That's great. Yeah. Thank you so much for sharing your story um, in such a powerful way. Some common threads that I hear through your story, and again today, we're joining together for health. I hear in your story, Wislyn, health in your mind, um, really pulls on a lot of different things. I think from what I'm hearing in your story, health in your mind has to do with physical health, but also mental and emotional health, and hearing your priority, making priority at a really young age, schooling, making that a priority in your life, making your faith in Christ a priority in your life, leading to health. And then obviously, seeing the need in your own community that you grew up in, through your service work. You mentioned that you traveled around and did some different mobile clinics and things like that. So yeah, just hearing you share your story really hits home the idea that health is multifaceted, and it's really encouraging to hear that that you took that from an early age. Now you're applying it to your work at CHIDA. I would love to hear kind of what's going on now at CHIDA, and I'm going to pull up this picture here. This is potentially to help explain some of the phrases and terms that we've utilized thus far in the presentation. Wislyn mentioned IDADEE and the IDADEE board. You can see at the top of this image here, IDADEE is at the top. IDADEE is an organization in Haiti made up of super talented Haitians that we've come to know and love over the years. Are good friends of ours. So it's a collection of people. A lot of them have grown up in the community at EBOC, but definitely around in the community. So through IDD and through their vision, it's really a vision for health and hope and healing for the whole community. So part of that vision, like we're saying, is health. It's CHIDA. It's a hospital. So you see CHIDA at the bottom there. Part of their vision has always been children's homes like the one Wislyn grew up in. There's another children's home called IDD. That's a part of the mission, part of the vision. Chapel, like we're saying, faith in Christ is central to the IDD community development vision. Schooling, like Wislyn said, is such a big thing everywhere in the world, but central again to the IDD vision. So this graphic helps kind of paint the picture of the overall health initiative that IDD is trying to bring forth. Wislyn mentioned PKF's partnership in that. We're really grateful to be um, helpful in any way that we can. Big part of that is fundraising and cheerleading and supporting IDD in their vision. So just thank you, Wislyn, for including us in that vision. So I'd love to hear a little bit and kind of transition into CHIDA today. Right now we're in the middle of a global pandemic. I would love to hear what's going on in Haiti, maybe specifically at CHIDA with COVID-19. Would love to hear how that's affecting your work.
Thank you, Jack. So as you have time to visit, and then you know the community of Wislyn, where CHIDA is, and then you know about why we decided to have a medical clinic, is to help people in the community because they were very in big needs for health, and the accessibility was difficult for them too when they're sick. As you know, in Haiti, people are not going to hospital because they feel sick.
Mm-hmm.
They go to hospital because they feel that they're gonna die. So when they decide to go to hospital, they are very, very sick, and sometimes, most of the time, it's at night. So that were the reason that we put pressure, and then we came together with PKF to have a place to help people. As I did is acting in different ways, but we could see that health was one of the big needs in the community. So as you know, we have already had big problem with the community because only 15% of them were able to pay the fees, the, the 10,000 fees that we asked them for consultation, for medication, for exam, for everything. They were difficult to be able to afford this bill. And so now, because of COVID-19, things are getting worse. But despite of all of this, because of our mission and determination, because of the the vision of IDD, and because of the way that we could see strange people like you from PKF are motivated to help people here. So we keep fighting. We keep fighting to keep helping the community. We keep fighting to bring good health for people in the community. We keep fighting to support the poorest one that are not the ones that are not able to go to hospital when they are sick. We keep fighting to support the one with malnutrition. We keep fighting to assist and educate the pregnancy women that are not coming to hospital because just they don't want to come. And then most of them they die from delivering. So that's
Hmm.
why we keep doing. But we were not able to do it without your support. We were not able to subsist because when COVID-19 came, if we used to have 10 people to come, so we have 5 now because people are scared about COVID-19. But the 5 ones that are able to come, about 1 or 2 of them are able to pay because people are getting poor, poor every day.
Hmm.
Because as you know about Haiti, things are not changing in the best and the good ways. Things are getting hard and harder day by day because of COVID-19. But
Right.
we were able to diagnose about 13 people with COVID-19. And then even we were not able to take care of them at all, but we were able to give them first care and send them to special place that receive people with COVID-19 is the place the public hospital and the Middle hospital that are bigger than our facility. But
Right.
we are trying to do what we can do. We keep, and then we plan to do more. We stand to do more and to support people and to help the community. Even now, the COVID-19 is getting low. It's a
Hmm.
good news, but we still in very big difficulties because of what COVID-19 did in Haiti and in this community and all around the world.
Yeah. So I'll just jump in and, yeah, potentially summarize what you said, but want to get back to, just how inspiring it is to hear you talk about your community, the passion you have for your community, your team fighting for your community. It's just super inspiring. And again, we're super thankful that you're willing to include us in that fight. Secondly, I would say, yeah, it's been really interesting in my conversations with you and with others. Luckily, like you just said, like you just finished, the cases in Haiti and at CHIDA specifically with COVID-19, they're not necessarily particularly high, but the impacts that you are seeing economically, socially,
Yeah,
um, that impact has been,
they're
detrimental.
huge.
Yeah, huge.
Yeah.
So to get that full picture from you on this call is really helpful. It's a good reminder to all of us to potentially look into some of the different ways that COVID-19 is affecting communities, especially communities in places like Haiti. So thank you for sharing all that information with us. Um, I would love to kind of go through some of these pictures, talk about some of these stats. You guys were able to achieve a lot in 2019. You're able to achieve a lot this year so far, but like we're saying, the impacts of COVID-19 financially, politically in Haiti have been great. So we want to do everything we can um, through this campaign, through our commitment to you, and to make sure that 2020 in the future, we can get back to these numbers, we can exceed these numbers. But just some things to point out, and a lot of things you already talked about, but over 11,000 patients at CHIDA in 2019. Um, I would love it, Wislyn, if you could talk about just kind of in your last phrase there, you talked about babies, you talked about women having access to healthcare, to safe deliveries. That's a big need that CHIDA is able to address in the community. Obviously, you just had a baby yourself. So if you could talk a little bit about some of the excitement that comes with this, potentially some of the challenges about healthcare, with women coming in needing access to healthcare, safe healthcare. So talk about babies. I know babies are on your mind.
Yeah. So I just have mine too, so you know that.
Right.
Yeah. So as I just said a few minutes ago, so one or two of the very big reason that we decided to have CHIDA was because of the way that we could see women dying when they are giving birth. So,
Mm-hmm.
and it's not because they want to die, but the first reason is that because of education, they were not educated enough to know when they are pregnant, they need to go to hospital. And the second reason is that because they wanted to go, but the way to go are too far from the house where they live. And the third reason is that maybe they know to go and they wanted to go, but they are not able to pay the fees because it's expensive for them. And they're poor. They are not people that they don't even have a job. But when we create two programs and at CHIDA too, one it was for the moms or for women, for any women that willing to have a baby some days, we were able to send people in the community to educate them, work with them, teach them, and
Mm-hmm.
then be close to them and let them know that we are here for them. They can come when they are pregnant. So we take care of them for 9 months and ready to deliver the baby for them. And that was a very good thing for the community. And that's one of the big things that we were able to accomplish in the community of Violin. And then that put away any kind of problem that they used to have with the babies, because when they not go to hospital, if there's malformation, any kind of problem with the baby inside, they won't know about it. But
Right.
when they deliver the baby and they see something abnormal, they think, oh, it's voodoo. But now we were able to put that things out of the mind because they know because they will not follow up, the baby may have some problem and they come. But since COVID-19 started, we were not able to send enough people in the community because of the challenge that we have. We had to restrain the amount of people of health community workers that we used to send. That's
Yeah.
one thing that maybe we need to work on and see if we can push it, because that's one of the big accomplishments for us. And the second problem was with babies is that, and it's kind of culture. Parents, they are not willing to bring kids to hospital. You know, they just think that as a kid, if you're sick, it's not like they don't used to do that. And that's why a lot of kids in the community, they have you see them, most of them they are malnourished kids. And some of them they are really sick because after some type of malnutrition, they become very, very sick that affect the kidney, affect the whole body. And then that's why we decided to create the malnutrition program. And same problem with the malnutrition program now.
Yeah.
We're not able to send enough people on the field to see as much people as they used to because of COVID-19. But we are working on this because those two things are very important for us, because that two of the big problems that we could see in the community, and they are two of the reason of CHIDA today. So we need to keep doing that. We need to go forward and see what we can do to help people. But I can say that the community, the people in the community, they are very pleased about CHIDA,
Mm-hmm.
because we're able to help them, even they are sick in the morning, in the afternoon, or by the middle night. they know there is a place that they can come all the time because they will find doctors, nurses, everyone to take care of them whenever they come. And
Yeah.
so, since we started, we were able to reduce about 24% mother that used to die in delivering. And then with malnutrition, we are able to about 6,000 kids with malnutrition, and we keep doing the program. So even we have big problem, even we have challenges, but we keep doing what we can do, and we hope that in the future we're able to do more and help this community, help those women, help those kids, and help the whole people in the community with their health. And that's what we plan to do. That's what we are doing, and that's what we keep doing.
That's great. Yeah, you mentioned a couple different things. You mentioned specifically the importance of um, the community health workers, and I would love to just kind of take a step back, explain that to our viewers that might be unfamiliar. But what you just described is a group of people on your staff. We refer to them as community health workers. They go out into the community. Oftentimes, they live in the community. Um, and they check in on patients. They check in on new mothers, like you're saying, walk them through the pregnancy process. You alluded to just how important that is in terms of education. Families now understand the importance of nutrition in their baby's health and development. That's just a fascinating and really exciting project that you guys have, that program. It sounds like it's made a huge difference in the lives of families, especially as it pertains to delivering babies and having safe pregnancies and education. You referenced the malnutrition program, which is directly tied to that community health program. But yeah, wow, I hadn't even thought about the ways that COVID-19 affects that program. Obviously, it's not necessarily a great time to be um, showing up at homes and knocking on families' doors and yeah, finding the correct balance between safety and respect and education. That's a lot to think through. I'm glad that you're still out in the community being active, but man, I hadn't thought about just how big of an impact that might be having on these programs that are so dependent on being out in the community and listening and things like that. So yeah, thanks for sharing. Um, anything else before we shift gears? I want to hear a little bit about your staff and kind of what's going on with them. But is there anything else that you would like to share with us in terms of what CHIDA's up to currently? Any specific challenges that you want to share that you haven't yet?
Yes, we have some of the challenges, and one of the biggest now for about 3 or 4 months is energy, is power,
Okay.
because our two generators broke, and one of them is won't be fixed anymore, and the second one we may be able to fix it, but because of the COVID-19, to go to Port-au-Prince or to Dominican Republic to get the part of that we need, difficult to get them, and then that cause sometimes we don't have energy to run the hospital. Even we have solar panel system that is not working very well, and that gave us some challenge sometimes, and we are not able to serve the people on time because we're waiting for energy. We need to look for some alternative, and that's one of the biggest challenge for now. And the second challenge is getting good meds. So we won't be able to give good healthcare without good meds. The most of meds that we get, they are from Dominican Republic, and we can't even trust them all.
Hmm.
But we used to get some meds from the US and some from other countries. But because of COVID-19 now, it's difficult, to across the bees from the borders, it's difficult. But we keep working on that to see what is possible to be done. because we don't want just give meds to people and knowing that they are not good meds. We can't do that. We won't do that. And so that's one of the two big challenge that we have. And then the other challenge is with the staff. Because of COVID-19, life is getting 3 or 4 times more expensive in Haiti. You know, when they used to have $10 or 20 or $2,000, was a good thing for them, was like a big thing for them to survive, to take care of themselves, take care of their family. So now you can see on their face some frustration sometimes because they are not against CHIDA. They are not against people that suffering, but it's because of life getting harder for them. You can't see them smile all the time as they used to.
Mm-hmm.
You can't see them, enjoying like they used to. They still willing working with us. They still, you know, show some enthusiasm, but you can see on their face some big difficulties. It's not because of anyone, it's just because of the country. Because Haiti, they are not producing, just waiting for the country, waiting for the people. And that's one of the third problem that we have. And beside of that, Shida is working very well. So we still have the staff, and then we still have patients that come, even the COVID-19 reduced the amount of people that used to come. But we hope that in a very close future, everything will go back home like they used to.
Mm-hmm. Yeah, thanks for sharing those challenges. Um, Obviously, hard to hear about the impacts it's having on your staff. Roger and I had the opportunity of visiting CHIDA not too long ago. We had the opportunity of meeting your staff, and like you just said, yeah, full of energy, lots of smiles.
Yeah.
But yeah, it is hard to hear.
But that's the
And
whole country, the whole
right,
country.
yeah, that's the whole country. That's unfortunately the scenario for a lot of people around the world right now.
Yeah.
And we're just really hopeful that at PKF, at where we are, um, across our listeners here, really hopeful and praying that we can help be a part of um, the process of helping those in need. For us, for me, it's people like those on your staff. So this fundraiser, this campaign is really important for a lot of reasons, but to bring health and hope to CHIDA and the staff and everybody in the community, it's crucially important. Yeah, Roger and I were super thankful and excited to be able to meet your staff, spend time with them. Amazing, inspiring group of people. I would love to hear, Wislyn, mainly just in closing, what your vision for the future might be for CHIDA. Anything that you want our listeners to know about CHIDA that maybe they don't know. I just would love to hear in the last kind of minutes we have together, anything that's on your heart, anything that God has been placing on your heart that you might want to share with us.
Yeah. So I can tell you that for the community, the most important thing now, they trust us. But the problem is that we are not able to help them in every way. When I said every way, because of some specialty, and not able to do some surgery because we still need a place for surgery.
Mm-hmm.
We still need to add some services. Like people are coming and they disagree when we had to send them to other hospital because the way that we treat them, they love to stay here. They would love to stay for everything here. But because we are limited in what we can do and we are limited in space that we have, we are not able to accomplish everything for them. And I think that's one of the only problems that they have with us. Because the way that we treat them, it's much different than everywhere where they can go. And they want to come and stay here for everything. But we are not able, you know, we are not
Yeah,
able.
so you mentioned
And,
specific needs in terms of the ability to
yeah,
perform surgeries, and
yeah.
those are real needs. We'll be doing our best to clearly articulate some of those needs in a lot of our communication to you all. Wislyn, you touched on a really interesting idea and point. You said that patients that come to CHIDA want to stay because they're treated differently. That sounds beautiful, and I would love it if you could share with us, why do you think that that is?
Yeah. So in my experience, even in public hospital in Haiti or private ones, the biggest problem with doctors, nurses, and everyone that serving in hospital is the way that they treat patients. It's, you know, it's not good because sometimes someone can come to hospital for a fever, and when he gets back home, he get more more sick because the way that we treat them, the way that we save them, you know, it's a big problem. So
Mm-hmm.
when we create CHIDA, as someone that had some experience, I said we will not do that. When someone come at CHIDA, they need to feel like they are home, you know, and they can trust everyone. And this is something that we took some time to work with our staff. Since we began, we had several meetings about how to treat people, you know, how to receive them. And then that's one of the first advantage that we have, the way that our staff is treating people, is receiving people. And with wisdom, with kindness, that's something that accounts for people when they come to you. The way that you talk to them, the way that you feel that you respect them, you respect their intimity, they like that. And the second thing is that when someone can have CHIDA for emergency, they won't ask you for money for the first time. You know,
Mm.
you take care of the people until they are able to go back home. That's when we will talk to them about what we can charge them. And that's something that made them people feel comfortable because they know we won't care about money first. We care about the problem. We care about the health. And then when they are able to go back home, when they get healed, ready to go home, that's when we will talk about the the money. And the the third thing is that I just told you about it. We 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 really want to give people the right meds that they need. There is some practice in Haiti. You know, I can come to you as a doctor and as a nurse, and then because you come to me, I will send you back home with some meds. Even it's not good for you, even it's not what you need. So we are not doing that in CHIDA. You know, we know what you need, exactly what you need. We try to give you exactly what you need. Even it's expensive, even it's a challenge for us to keep it. But if you come for something, you need to go back home, with joy because you came for something and you receive what you needed. So, and the other thing is that the way is whenever they come in CHIDA, they will find people to serve them because we have the doctors that live here and nurses that stay here all the time, everybody, and we have people in the lab all the time. So when they come, they won't have to wait for a long time for a doctor, for a nurse, or whatever. When they come right away, we are able to serve them, even in the morning, even in the night. People are here to serve people, and that's something that people like. That's why when they come here, they want to stay here. There are several patients that we send to public hospital, or sometimes we send them to Miller's Hospital when they feel, when we give them first care and then we send them to for the rest of the treatment. Some of them they don't want to go, want to stay here. And there was a woman 2 weeks ago that said, "Let me die here. Please let me die here. I don't want to go to the public hospital because I want to see people taking care of." you know, and that's something that touched my heart, touched my soul. And then we want to do more, and we want to keep treating them like that. We want them to keep trusting us, but there are some challenges. We need to face that.
Definitely. Yeah. Thank you so much for sharing all of that. Yeah. And just that story with that woman that you just finished with, obviously very moving. You know, being here across the ocean, hearing a need like that, it can seem far away, it can seem removed from my day to day, but the reality of our situation here at the PKF, we are in a position uh, to play a part in that woman's health. And I think those of you watching, those of you that are care enough to tune in to this video and hear Wislyn's story, you guys have a role to play in this as well. I'm super thankful for being included in Wislyn's vision for his community. I would hope that you guys would take Wislyn's story, take that woman's story away with you. Consider what you can do to make CHIDA a place where people can come. People can come, feel safe, feel cared for. But let's fight to make CHIDA a place where they can get the meds they need. They can get the surgeries that they need, because like Wislyn started his whole presentation out with, our conversation was rooted in health being physical, emotional, spiritual. CHIDA is a place where patients can get that. We want to do everything we can to allow Wislyn and his team to do that. So Wislyn, thank you so much for speaking with us. Thank you so much for all the sacrifices you're making for your community. I really appreciated catching up with you. It was great to see you. Anything before we officially end our call that you wanna end with?
So I wanna thank you, Jack, and thank you, Roger, and wanna thank you, PKF, for everything that you're helping us to do in the community. We have determination to do good things, but without your support, without your sacrifices, and I know that every day you keep thinking, fighting, and looking for good stuff, good programs for IDD, for CHIDA, for EBAC, for Pastor Jean-Claude, for everyone that working in the field here in Haiti. So we want to thank you for everything. And all the big things that we are able to do in the community is because of your effort. If we are able to change the mind of the community here today, is because of what you're doing back there in the United States. Please don't let us keep doing that, keep doing impact together, because we are in this adventure together. Thank you for everything.
Thank you, Wislyn. We'll talk to you again soon.